Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, February 17th. I'm Sean Duhimmel. Thank you so much for joining with us and tuning in again this week. Now, the bulk of this week's message is going to focus on healthcare, but I have a couple of quick updates for everybody that are just as important. First and foremost, all of our members should now be in receipt of our March 2023 newsletter, The Voice. Again, it is chock full of breaking news relative to your pension, your health insurance, really everything related to the things that are most important to you as a public retiree. Right here on the front page, we're talking about the Group Insurance Commission and how we now know for certain the details of their plan design, which I'm going to get to in just a moment. We're also covering all of the legislation that we have filed for this year. And on page 3 of the newsletter, as always, is our events calendar. It's our complete list of upcoming events. We will be holding in-person membership meetings starting in April, running through the spring and then into the fall. We're looking forward to getting back out there in all corners of Massachusetts to meet with our members face-to-face. But in addition to that, we will continue to hold teletown hall meetings. The meeting we had a month ago with the Group Insurance Commission was our most successful virtual meeting yet. We had over 6,500 members participate in that meeting with the GIC. And as a matter of fact, at yesterday's GIC meeting, Executive Director Matt Vino informed his 17-member commission of just how important the meeting was to the GIC and how grateful he was for the feedback that he got from public retirees. So for those of you who took the time to participate in that meeting, thank you so much. You made a really good impression, which the most important thing is it gives us a voice and a seat at the table when these types of decisions are being made, and it leads to better outcomes. So with that, let me jump into the additional news of the week. Now, speaking of the legislation that we filed, just this week we learned who the legislative chairman will be for this legislative session, which is the 2023-2024 legislative session. It runs for 2 years. On Wednesday, the state Senate released its committee chairs as well as the members of the committee, and then yesterday afternoon the House of Representatives did the same thing. We are delighted and very, very grateful for the fact that both of the sitting chairmen of the Joint Committee on Public Service, State Senator Mike Brady, our good friend from the city of Brockton, has been reappointed as the Senate Chair of Public Service, and our good friend Ken Gordon, Representative Ken Gordon, from the town of Bedford, will once again serve as the House Chairman of the Public Service Committee. Now, why this is so important to us is quite simple. The Joint Committee on Public Service is the legislative committee where just about all public retirement legislation originates, and it is vital to us to have chairman of the committee and staff who not only understand and can get into the details of how our retirement systems work and how our health insurance benefits work and so forth, but are also dedicated to these issues and support these issues on behalf of public retirees. So the fact that we have 2 chairmen returning to the committee as once again, along with the same staff people who have worked on the committee for the past couple of years, in the case of Senator Brady, even longer than that, it really bodes well for our chances to advance some of the legislation that is most important to us for this legislative session. Things like the COLA, the basic life insurance, veterans benefits, and so forth, just to name a few of the top line items. Now, we have already begun to hold or to meet with legislative leaders in preparation for the upcoming state budget. Governor Healy will be filing her budget in about 2 weeks. She has until March 1st to unveil her first budget proposal. So we are hopeful that the state and teacher COLA, for instance, might be able to be included in this year's upcoming budget, which is the fiscal year 24 budget. So those are the things that we're working on in terms of the legislative process and why the announcement this week of who the chairs are is so important. Now, we're anticipating that in about a month or so, 4 or 5 weeks from now, we should see the start of public hearings where the legislation that we have filed for this session will begin to be heard. We will be providing a full update on our legislative package in the May newsletter that you will receive in early April. So with that, let me turn to the main news of the week, which of course is health insurance. Now, as I mentioned, the state's Group Insurance Commission met yesterday morning, and as anticipated, the 17-member commission approved and voted for, I believe unanimously, the plan design recommendations that were unveiled back in January by the GIC staff. Now, by and large, the plan design that has been approved is very beneficial to retirees. For instance, this will be the 6th consecutive year where we have seen no increases whatsoever in prescription drug copayments, as well as no increase in the annual deductible that is applied to some of the GIC plans, primarily the non-Medicare plans, which the annual deductible as of now is $500 per person, or $1,000 per family per year. And again, this will be the 6th consecutive year coming up where we have seen no increases in either one of those benefits. Now, the one area that we have seen some adjustment and some slight increases is some of the office visit copayments. In the GIC, particularly under the Unicare plan, and we wish this wasn't the case, we're never happy to see any copayments or deductibles increase, but from time to time, unfortunately, it's inevitable. It's the times that we're living in. But the GIC has chosen to equalize some of the doctor visit copayments across all of their plans. So depending on which plan you happen to be enrolled in which doctor or medical providers that you're seeing, you may see some slight differences in the office visit copayment that you're paying now as opposed to what you may be paying in July. And our current newsletter has some of that information. Our May newsletter, which again will be out in early April, will have further details on this. Our May newsletter will also include the complete breakdown of the premium contribution rates that will be charged to retirees beginning in June. That decision will take place on March 2nd, so just about 2 weeks from yesterday, as a matter of fact, is when the GIC will make that announcement. Now, we are anticipating that health insurance costs are going to go up. The GIC has publicly stated that the range of increase will be on average somewhere between 4 to 8%. We're anticipating that the increase for the Medicare plans will probably be on the lower end of that scale. But unfortunately, excuse me, we are anticipating medical costs going up. They're going up across the country. They're going up in the private sector here in Massachusetts. Now, thankfully, for the public sector plans, whether it's the plans run by the GIC or by Blue Cross Blue Shield at the local level and some of the other carriers at the local level, we have seen the increases be far less than what we've seen for the same type of private sector plan. So we're doing a good job across the board of managing our healthcare costs and trying to keep a lid on the growth of these costs. But unfortunately, we're still seeing inflation raise its ugly head and continue to raise these prices a little bit. But again, we'll have the full details coming up after the GIC's March 2nd meeting. Now, in terms of healthcare, there's a couple of other points that I want to make that are very important. As all of you know, when you turn 65, if you're a public retiree, state law requires that if you're Medicare eligible, you have to enroll in a Medicare plan. The state or the city or town that you're retired from will provide you with the Medicare supplement. So you're not losing anything, nothing's being taken away from you. The reason for this law is quite simply that under Medicare, the federal government picks up the lion's share of your health insurance costs, which saves retirees money, it saves the Commonwealth money, it saves municipalities money. So if you're turning 65, in today's email message from me, there's a link to the GIC's website, and this same process applies to local retirees just as well as state retirees. But the GIC has a very helpful video on their website about what retirees need to be thinking about and what steps you need to take to enroll in Medicare and enroll in a Medicare supplement plan just prior to your 65th birthday. So that link is contained in today's email message. If you have any questions for us after watching the video, give Cheryl Stillman a call. Her telephone number, if you can't reach her here in the office, her number is contained on the back of your membership card. Now, also with Medicare, we continue to receive a growing number of alarming calls and questions from members who are receiving very aggressive solicitations from Medicare Advantage companies, or at least a handful of Medicare Advantage companies. These companies are not, they're private sector companies, they're corporations, and for the most part, they're not part of the government, even though at times they may introduce themselves as calling from Medicare, which some retirees find very misleading, and it is misleading. These are private companies selling a product. And these are the same companies that you're seeing by and large advertised on late night TV and on radio commercials, in direct mail that you may be receiving. But it appears that these, at least some of these companies, have taken a slightly more aggressive approach this year and are cold calling retirees, trying to convince you to drop your GIC coverage or your local municipal health insurance coverage and enroll in one of these private Medicare Advantage plans. Now, as we have said in the past, these plans are not the same as what you're getting from the GIC or from the city or town that you retired from. In most cases, they are inferior to the type of coverage you have right now. And even though the sales pitch may sound good and it might seem enticing and cost-effective to switch coverage, at the end of the day, you're not going to be happy with the coverage you're going to get, and that's in most cases. So our advice to you is ignore these solicitations, do not fall for the sales pitch, and whatever you do, do not drop your GIC coverage or your local coverage in lieu of one of these other plans. They're not the same, and as all of us learned as children, and my mother made sure, my brother and I, this was ingrained in our heads, if something seems to be too good to be true, it almost always is. And we just need to be very careful of the types of solicitations that we're getting. I know it can be confusing, and there's a lot of information coming at us, and we're always looking for ways to save a little bit of money. That's great, but you don't want to get into a situation where you're not going to have adequate health insurance coverage if you get sick or you get hurt or you need to go to the doctor for some reason. So I just wanted to put that out there for our members because we are having a growing number of questions. Now, the insurance companies, the Unicare, Blue Cross, GIC, and so forth, Harvard Pilgrim Tufts, they're all getting the same questions. And Unicare this year, to their credit, has taken a step to create on their website a side-by-side comparison of the Unicare Medicare Extension Plan versus a Medicare Advantage plan, a private Medicare Advantage plan, because there are two types of Medicare Advantage. There are the private plans that you see being advertised and you're being solicited to join, but there's also the group Medicare Advantage plans that Blue Cross offers, that Tufts offers, the GIC has it as part of their insurance offerings. Those are good plans. Now, you always should, discover the details before you're choosing which plan to enroll in, but all of the plans that the GIC is offering are good plans. Same with Blue Cross Blue Shield. Now, what Unicare has done is provide a side-by-side comparison to answer basic questions about the differences between the two types of insurance. So that link is also included within today's email message from me. Now, if you are a Mass Retirees member and you're watching this video either on YouTube or through Facebook, if you're not receiving my weekly email message, let us know. We want to make sure that we're getting this information to all of our members. The email message that comes out along with this video every week provides a little bit of additional information that goes to our members only. The other thing I'd like to ask you to do is please like and subscribe to this channel. If you're on YouTube, like the video, please subscribe to our channel. That way you're getting this information every week that when it comes out, and the same on Facebook. These are great vehicles for us to keep you well informed, that make sure that you have all of the information that you need in order to make the best decisions as a retiree. So with that, I'm going to log off for the week. Thank you so much for tuning in, and we will be back to you again next Friday. Take care, everybody.